For our next session, ladies and gentlemen, Muscle is Medicine. She is right here, she's excited already. Please put your hands together and make some noise for Dr. Aeisha Asmadi. Doctor.
Good afternoon, everyone. Thank you for being here today. My name is Dr. Aeisha, a medical fitness consultant, breast cancer survivor, and two times cancer survivor and bodybuilding champion. Today, I want to talk to you about Muscle is Medicine. It is an honor for me to be here today at Disruptive Doctors Conference and Exhibition 2025. I want to start my talk with a question. What if there is a single organ in our body that can protect our health, our brain, our metabolic health, our hormone, and also fight cancer and extend our lifespan? Would you prescribe it? I would. That organ is the skeletal muscle. Today, I want to share with you an aha moment why muscle is medicine, why it is our weapon against many diseases. And us, as doctors, we need to prescribe muscle health. Agree? Now, let us define longevity. When we talk about longevity, we always focus on lifespan. Today, in medicine, we are shifting our focus to lifespan. When we talk about lifespan, it's about numbers of years lived, but when we talk about health span, it's the years that we live in good health, without disability, and be able to maintain independence. Right now, the trend is biohacking, stem cell. We know about GLP-1 weight loss drugs, the fascination with supplements, and the longevity clinic booming in the medicine space. The reality is, none of those matters if the foundation is not right, which is to have a healthy skeletal muscle. If you lose your muscle, you will develop this condition called sarcopenia. It's one of the strongest predictors of frailty, disability. You fall and be hospitalized and increased risk of mortality. If you have low skeletal muscle mass, there is a higher chance of mortality. The recent meta-analysis 2023 is a prospective studies, 16 prospective cohort studies with 81,000 participants followed for 14 years. The result is clear. If you have low skeletal muscle index, you have a higher risk up to 57% of all-cause mortality. And surprisingly, the risk is present in all BMI group, meaning if your BMI is normal and you still have low skeletal muscle index, the risk is as the same, 57%. So remember this, muscle mass is a predictor of survival. Now, the biggest question here, why muscle is medicine? The number one reason, muscle is a metabolic sink. It is your metabolic insurance to help you achieve metabolic health for a long time. What I mean by that, muscle is the primary site of glucose uptake and storage. We have our liver, the organ of metabolism, but did you know liver only stores 100 grams of glycogen? That's where you just ate, right, during the lunch? So your rice, your potato, they all stored in the liver. And muscle. Muscle able to store 300 to 500 grams of glycogen and up to 5 times more compared to liver. So this is how powerful our muscle is. The more muscle you have better glucose disposal, and this lower your chance of having diabetes and metabolic syndrome risk. So have muscle and you can handle your rice better. We as Asians, we love our rice. We eat everything with rice. Did you eat rice today? So I see one of the fittest people here, he said no. So he knows the secret. Because if you're able to handle your muscle or your sugar, you can get all the carbs in the world. So take more muscle and enjoy your carbs. Another thing about muscle, it is a reservoir of amino acids. The more muscle you have, the better you can buffer metabolic stress. So you have more reserve for recovery from surgery and illness. This is when your protein intake is low. Remember this, muscle is a protection against diseases and help you survive when the scenario is not in your favor. Think of muscle like your life insurance. Reason number 2 why muscle is medicine. Did you know muscle is an endocrine organ? Amazing, right? What happens when you exercise? The muscle releases a hormone-like molecules called myokines. Myokine released during contraction, and this helps fight inflammation, improve immunity, and even suppress tumor growth. In studies shown there is a term coined muscle tumor crosstalk. So tumor and muscle, they are communicating through myokines. So the myokine released by muscle, they can suppress tumor growth and slow cancer progression. I would like to share with you a personal story. I'm a 2 times breast cancer survivor. I had cancer when I was 21 years old. 5 years later, I had my second cancer at 26 years old. And both times I was very young. And I learned firsthand how important muscle is for my survivability. I'm very lucky as a medical doctor. I'm exposed to the knowledge and I'm here to share with you because I live it firsthand. So I hope that whenever you experience something negative in your life and you remember my message and you start strength training, and this is my gift for you. Remember, muscle mass help you fight cancer and improve survivability. Number 3, why muscle is medicine? Muscle protect against diseases. I'm not just talking about cancer. I'm talking about heart health, cancer death, infections, Alzheimer to protect your brain, depression symptoms, and even falls, fracture, and ICU time. All these studies that has been done showed a clear message. Muscle protect against many scenarios. You will be able to fight diseases and increase your body resilience when the time comes. Especially in women, a study has found a midlife fitness protects against dementia and hip fracture. So why I focus on midlife? Because when you are 40 years old, your fitness starts at 30 years old. If you are 40 years old, you haven't started your fitness, think about how you're going to navigate your life at 50 years old. The thing is, menopause is coming. We live like it's not going to happen to us. We think that the time is a status quo, but time changes. So we also have to prepare for the future. So for women here who are scared of resistance training, strength training, I highly advise you to get engaged with a coach or a doctor and learn the correct technique, because building muscle requires technical and safety. So once you're able to overcome this block, you will enjoy a better lifespan and health span. Now, I'm sure a lot of my audience here are doctors. As clinicians, how do we measure and monitor our muscle health? The best way is functional testing. Number one is grip strength. Grip strength is the most popular functional testing in academic journal. It's not just about muscle health. A lot of studies out there also correlate grip strength with cardiovascular health and even erectile dysfunction. So just search grip strength and learn about how having a strong grip strength is important in morbidity and mortality prevention. Secondly is sit to stand. Sit to stand is, are you able to sit and stand, because this resembles your leg strength. So of all the muscles in the body, the most important one is your leg. It's a weight-bearing body part. So you want to have a strong leg. Learn how to squat, deadlift, pick something from the floor, sit, and make your body resilient against fall. Number three, gait speed. Did you know as you age, you tend to be really slow? So as you age, the first thing that you lose is not strength, it's actually speed. You're getting slower. When you look at kids, they are like hyperactive, they are moving really fast because they are speedy, they just can't stop, like calm down. I can't because I'm explosive, I have speed. And then when you don't maintain our fitness, and as we go through aging, we notice our speed is slow, we are less explosive. So speed has been introduced in training, and it's also one of the parameters that you can gauge the muscle health of your patient. And the third thing is balance testing, the single leg balance. Why this is really important for your health is because a lot of patients, when they develop frailty due to low muscle mass, they trip, they fall. And what happened? They sustain fracture. And why they have fracture in the first place? Because they have a weak bone. They don't do resistance training. This is why you have to educate your patient to do some form of anti-gravity, carry some heavy load and resistance training in order for them to be balanced and centered, so they are more resilient to fall. Okay? Secondly, this is what I use in my clinic. This is a medical grade body index analysis called a SECA machine. So we use this to analyze body index patient, their muscle to fat ratio. Yes, BMI is important for obesity classification. The way I see it, personal opinion, I use BMI as a screening tool. If visually the person looks obese, I want to find out the BMI that he sits or she sits at to know the classification of obesity, so I'm able to make clinical decision making. So for general public who say BMI is useless, you have to educate them that it is a screening tool. We use it to make an informed decision about treatment. And then the BIA, body index analysis, is the most important thing in longevity. BMI is more about size. Okay? It doesn't reflect your fitness and your true health. Okay, let me explain. When you look at BMI, someone has 18 kg per meter square, 20 and 35, let's say. Low, middle, and high. Just look at it as you are an S, you are an L, you are triple XL. So most people are wearing SL. You don't have to see them, they are obese. This is your first thinking. But what if the person comes to you and he is a bodybuilder? So always use your eyes to screen as well. So most doctors have this mistake. And a lot of people in the fitness space are very frustrated when they are being told they are obese from BMI per se. So the tip for you doctors, if you see someone who are very fit and have a high BMI, you have to do body index analysis. or else you are going to give them the wrong information about their health. Okay? And another modality we can use is the DEXA scan, which is very accurate but expensive. So this is where you can gauge their skeletal muscle health. Now, let's go to lab testing. So I hardly look at lab testing, to be honest with you, but looking at creatinine and cystatin C indirectly, I can gauge about their muscle mass because it's a metabolic product from having muscle. So when the person have a very low creatinine and very frail, that can indicate this person probably have atrophy and low muscle mass. And this is at the academic and research level, myostatin and IGF-1, which is an anabolic, and myostatin is a negative regulator for hormone growth. So as you can see in this photo, this very famous picture, if there's a mutation in the gene of myostatin, they have this doubling muscle. So all the muscle is double because the myostatin is actually keeping the muscle growth at bay. So if you are modulating your gene, and I say, I don't want this myostatin, because this myostatin stops my muscle growth, so your muscle growth is inhibited. And therefore you get this condition. Okay? Now, we all know about GLP-1 agonists, and everybody is chasing accelerated muscle loss, weight loss, sorry. And now we have tirzepatide. So it is really big in the weight loss scene, in the medical scene. The challenge is, when you lose weight too rapidly, you're also at risk of losing muscle mass, in the case of non-strength trained patient. So when you want to give GLP-1 agonist to your patient, you have to include strength training in their protocol because strength training is a stimulus to retain muscle mass. Muscle mass is a metabolic expensive. So patients burn more when they have higher muscle mass. So remember, look back at your weight loss protocol, how to use GLP-1 properly, and include strength training and protocol to retain muscle mass. If you do not address this, we risk trading obesity for sarcopenia. Muscle loss and sarcopenia. Sarcopenia is a new disease entity recognized as an accelerated muscle loss. It is actually pathological. Definition of sarcopenia is a progressive, it's getting worse, generalized skeletal muscle disorder characterized by loss of muscle mass, loss of strength, and function. The European Working Group on Sarcopenia of Older People, 2019, described sarcopenia as a muscle disease rooted in adverse muscle changes that occur across a lifetime. Did you know sarcopenia is a pathological aging? It's a disease entity, it's a recognized clinical condition. It's not a normal, healthy aging. What happened? What is the pathophysio of sarcopenia? Your muscle fibers atrophy, neuromuscular junction degrades, there's a low grade of inflammation in the combination of insulin resistance and mitochondrial decline. Meaning, the pathophysio or sarcopenia is complex and multifactorial. So we need to address this so that we can improve our patients' longevity. Well, is sarcopenia the death sentence for me then, for aging? Well, you can't reverse muscle loss completely. You can't reverse aging, you can't reverse aging. It's not inevitable though, because exercise preserves muscle. This is my favorite MRI. My favorite MRI to share with my clients and my audience so that we can open our eyes and open our mind that despite any age, we can still build muscle. This is an MRI of a triathlete versus sedentary. As you can see, there are three pictures. 40 years old triathlete. The gray area is muscle, and the white area is adipose tissue. So it's very little at 40 years old triathlete, and 74 years old sedentary man versus 74 years old triathlete. Look at 70 years old versus 40 years old triathlete. Isn't it amazing? It means at 70 years triathlete, with exercise, you can still maintain your muscle as good as when you are 40. But when you are at 74 years old, being sedentary, your muscle atrophy, and you can see fat infiltrated in the muscle. So this is not a healthy skeletal muscle. Exercise is medicine. This is the missing prescription. Why doctors do not prescribe exercise? Because we are not trained. Over 50% of doctors receive no formal education in exercise science. Okay, there are two frameworks I want to share with you here. For healthy aging, this is what you can advise your patients. FACE, developed and coined by Dr. von der Wright, a leader in longevity medicine and orthopedic surgeon. She said she developed this FAC term, F for flexibility, A for aerobic exercise, and C, carrier load, and P, equilibrium, meaning balance. Flexibility means you have to incorporate dynamic stretches to move muscle and joints through their full range of motion. This is to maintain mobility and range of function. And aerobic exercise, any activity that elevates heart rate, such as brisk walking or cycling, to maintain your cardiovascular health and pulmonary health. Carrier load, what does it mean? Start resistance training or lifting heavy load to maintain muscle and bone strength. Equilibrium, dedicate time to balance exercises, whether by standing on one foot while brushing your teeth or taking a Tai Chi class. Emphasize in balance to prevent falls and to improve everyday stability. Now, the most important part is the exercise prescription for resistance training. We use ACSM guideline FIT-TVP principle, F for frequency, I for intensity, time, type, and V for volume, and P for progression. Frequency 2 to 3 days a week. Remember, as you get older, your recovery not very good as when you are younger, so split it between your recovery days, non-consecutive days. And intensity, stick to moderate to vigorous for advanced, and for beginner, lower your intensity to 40 to 50% 1 RM. And for time, there's no strict duration, you can quit anytime, as long as you can recover. And type, focus on multi-joint big movement that use a compound exercise, such as squat, deadlift, push-up. So one movement using different joints. And volume is about 2 to 4 sets of 8 to 12 reps for strength and hypertrophy, and 6 to 10 to 15 for beginner and older adults. And you have to train, you have to introduce progressive overload. Without progressive overload, you are not able to give them the right stimulus and the right adaptation. A lot of people are missing this component, which is the progression. So if you do 2 kg today, 4 kg next week. Everything has to be in a progressive manner. If you do 5 reps today, increase the reps up, then the week after. So structure the exercise properly. The minimum effective dose to have this benefit of resistance training is to spend 15 minutes per week of resistance training to improve longevity and your health. Now, this is my final thought. Longevity is not written only in your DNA. It is built every single day through the choices you make. The strongest choice you can prescribe is muscle. So let's move beyond medication. Let's prescribe resistant exercise. Thank you.
Thank you. Once again, ladies and gentlemen, for a big round of applause for Dr. Aeisha. Thank you for the insightful session. Do we have any questions from the floor? We'll get our... if you want to connect with Dr. Aeisha, please... not anymore. think no more. I will get our Slido QR code on screen as well, but do we have any questions from the floor before we move on?
Any questions from the floor?
Yes, fantastic. For those of you who have your headphones with you, get them ready. A QR code should be happening on screen soon.
What are your thoughts, between the DEXA scan versus there's many other tools and equipment out there that study body composition to quite different extents of accuracy, right? So if the DEXA scan is on one side, presumably that's the most accurate. What are some other ones, in case, like, say, cost is a factor, right? You can't afford to put one in a clinic. What are some other ones that you would recommend?
Thank you for your question. So when we're speaking about body index analysis, there are several methods that I tend to use, and they all have their pros and their cons. So everything has to be personalized to the patient's budget, to the patient's condition, and either they are general public, they are clinical patient, or they are athlete in a high performance level. So the more they are in that right group or the extreme group, it is better to go for accuracy. And for general population, you can approach something more cost effective. So yes, the DEXA scan, the problem is the availability. The machine is costly, but it's very accurate. So I personally use it in my competition preparation for bodybuilding because I need the accuracy as it is a competitive sport, competitive physique sport. For DEXA scan, you can use it to truly engage the health of the bone. And simple too, like your eyes. If the person has six-pack, you can see that the person is lean. And body caliper to assess the body fat. And one more thing is your weighing scale. If the person does not have access to body index analysis, but if you monitor the story of the patients, you are part of the transforming journey, you can tell roughly the story of the physiology of the body by monitoring the weight scale. So this is the method that I use. The accuracy is fluctuates, but depends on the patient. Personalized prescription, personalized tool is one of my favorite. I like to personalize everything to my client and my patients. Remember to personalize on their budget as well.
Good one. We have one more question from the floor.
Thank you, Dr. Aeisha. That's a very inspirational talk, and I'm really, really pleased that you're talking about something so fundamental, especially in today's health landscape, where there are so many people who are under-muscled, struggling with metabolic conditions, and this rising burden of NCDs, non-communicable diseases. My question is in an environment where doctors, gatekeepers to health are time poor, and there is a wanting in health literacy amongst the general public, how do doctors communicate effectively, with these kind of barriers and hurdles that they have in order to engage their patients and give them very practical, tools to be able to impart for their patients? Because it goes without saying that just about everybody that walks into primary healthcare setting is going to benefit from resistance training in some way, shape or form. So how do doctors, impart with their hurdles and barriers, impart some very simple, interventions for their patients?
Thank you, that is such a great question. So this is why I'm here today to explain to the doctors the importance of resistance training and to integrate it in their clinical practice. So the way I see it is first to build awareness among the doctors, the importance of building strength and having high muscle mass. And secondly, educate the doctors to get involved in the resistance training as well. Because the resistance training is highly technical and practical component, if you do not have a personal engagement with the sports or with the activity, it's very hard for you to being true to your words. So the patient nowadays is very smart. When they take advice from the doctor, they know that the advice is correct. But they cannot actually stick to the advice when the doctor himself or herself is not maintaining a healthy lifestyle. And I see it over and over again in Instagram. You know, I'm sorry to be rude, but I saw the comment on Instagram. The general public will say something really bad, like, "Alah, doktor pun gemuk. Kenapa nak follow advice dia?" And then they say, "Don't shoot the messenger when the message is correct." But the thing is, we are in a service industry. We have to work in alignment with the public psychology. So you tap into the psychology, you be the person that they can inspire to be, and therefore your advice stays. You become their inner voice. And for me, I believe doctors shouldn't be in the treatment space. We should be here to inspire people and advocate for health and be true to our words because we walk the talk.
Alright, we have some questions maybe from the floor on screen as well, Doc. Right over here. I think apart from resistance training, do you also prescribe any fitness supplements, creatine, whey for the patients?
My background as an athlete and as an exercise prescription with advanced postgraduate clinical training in sport and exercise medicine. I work in the athlete space and also attached in National Sports Institute for a short time, and I believe in health optimization. What I want to share with you, this health optimization approach is currently reserved for athletes, and I realize that we should know how to take sport supplement, and sport supplement should have a space in the wellness supplement. Yes, there is a role of creatine and whey protein, and in my study, it is part of our sport supplementation protocol. And I believe when patients and our clients start to be active, they need to understand that demand is higher and they have to fill in the gaps to supplementation.
We have one more here, right here. What's the HR max or HR target range that should be used for patients when we prescribe exercise to patients?
Okay, HR max and HR target, it depends on individual. Exercise have to be personalized, and you have to categorize your patient into 3 categories: clinical patient, general population, athlete, and high performance. Okay? So high performance, their heart rate to be very low. 48 is normal in triathlete, 50, I've seen it. So, we talk about zone 1, zone 2. This is the fat burning zone, and you see this zone, you want to stay in a safe zone for a beginner, but occasionally you want to challenge your heart, do something like explosive, like sprinting for a short duration to go to the maximum heart rate. So explosiveness is something that can preserve aging. Like you will be able to retain your speed and explosiveness if you include sprinting once a week. The problem with this type of training, you can't do it regularly because it has high fatigue level. So therefore, if you are also training and walk the talk, you will be able to advise properly because you know how it is. If you sprint, sometimes it takes 3 days to recover. So that's why you're able to advise exercise like a prescription. The pill has to come with the dose, with the frequency, with the timing. Okay?
One more right over here. How to balance between cardio and weightlifting?
It depends also on the person. Time is the block. If women manage household and have kids to take care, they are short on time. So when I prescribe exercise to my patient, I need to understand their time management, and I help them manage their time. So you ask the patient to tell me what is your 24 hours like, and then you will find out a slot where she can squeeze in the exercise. But for persons who have time, you have to introduce 2 resistance training days that involve multi-organ. As long as no muscle is left behind. So you don't just train your upper body and forget your lower body. You have to train upper body with the front component, push and pull, the back component. Same as leg, the front part and the back part, and the center, which is the core. And for cardio, I advise to do it separately because the training has to be specific. So one of the principles of training is the specificity. If you want to improve your aerobic, you just train your aerobic. If you want to improve your strength, you train your strength. But if you want to improve your general fitness, you can combine both together. So when doing in combination, it is more cardio than a true resistance strength because your strength will be dropped if you integrate cardio together with strength training.
I see, so it's a full range for the day and so on, yeah? We have one more before we carry on. Amazing topic, how to become a medical fitness doctor. Right on top.
Okay, to get into this journey, you can be a medical doctor and take a certification such as Exercise Prescription that is being offered by Exercise Medicine Malaysia, or you can take another specialty or post-clinical grade training, which is sport and exercise medicine, or you can take a personal training certification and become a personal trainer yourself. And in this way, you'll be able to train your client and also train yourself. You know how to train yourself, that's the most important thing. So look at it as an investment to your longevity.
Nice. All right, once again, ladies and gentlemen, please give a big round of applause for Dr. Aeisha. There are some questions out on stage, but Dr. Aeisha and her team will be around at the booth. And also right over here, if you have any one-on-one questions, you can please proceed to her and get that answered.